Here we have the 90-90 breathing exercise. We're going to do two things today. First, we're going to teach you how to breathe. If you think, the first things you do as you come out of the womb is breathe. It's the most vital function. Your body's always going to choose breathing. So even though you might be able to squat or deadlift or run or do these exercises, if your breathing patterns are off, your body's compensating to adjust for that. It's looking for that stability, but you're getting it from somewhere else. And that's where pain tends to happen when we put stress elsewhere where it shouldn't be. Second thing is the 90-90 position. We're going to use this block and this foam roll to put our back in a natural decompressive state where we're using gravity to just very subtly elongate. There's going to be zero pressure on it. We're just going to use gravity to elongate it. Paired with breathing, it's a nice way to stretch out everything in the low back. The purpose of this is, like I said, two things. Teach you how to breathe. It's a foundational movement that we teach. But also, if you're in severe pain, incredible pain, it's a nice way just to try and calm down, find a positions of comfort. Almost everyone's going to get significant relief by putting their feet up on the couch, holding a foam roll, and just trying to breathe and relax in this position. Let's walk you through it. So what you're going to do, so you have a box, great, or a bolster. What I do at home is I lay on the ground and put my feet up on the couch. Almost all couches are the right height. If you don't have a couch that's the right height, use a chair. But here we have a box. 90-90 means 90 degrees here and 90 degrees here. So ideally, the box should be at the level of your knees when you're in this position. You're going to take your foam roll, and you're going to drive it between your knees, so the knees are nice and aligned with the hips. And you're doing a very subtle 10%, 20% contraction on that foam roll. I'm not squeezing it out of full might. I'm just holding it there so I feel those groins engaged just a little bit. So tactical breathing, as hopefully you read about in our free guide, is 4-second inhale, 4-second hold, 4-second exhale, 4-second hold. It's a nice way to calm down your nervous system, focus on your breath, stress your system just a tiny bit, goodness. Stress your system just a tiny bit and improve the gas exchange so we get the right chemicals going through our body. So in this position, I'm very subtly squeezing the foam roll and I'm very subtly driving my heels into the block so the hamstrings are engaged. So I'm going to take a big deep breath in. As I inhale, I'm not just sticking the belly up, and I'm also not increasing my chest up. So we'll talk about this in your appointment, but for the basics of it, try and inhale into your belly and inhale into your sides. If you have to, the perfect is put your thumbs into your back and try and, as you inhale, feel pressure go into your thumbs. But we'll talk about that. Don't fret about that. Just think, breathe into your belly. As that belly increases, 4-second hold. I hold it here. As I exhale, hold it here. 3, 4, hold. Now let's talk about the exhale. When you're exhaling, it's not just a passive, relaxed. It's a little bit of an active exhalation. So as I inhale, pushing out. As I exhale, these ribs, I try and dive downwards. My belly button, I try and drive inwards. And I actually try and push my side bodies outwards. So I'm expanding. That expansion is actually lengthening out your spine, lengthening out your back muscles, taking the stress off the discs, off the ligaments, off the joints. That's why the importance of breathing, the importance of your pillar, your core. Inhale, expansion, lengthening out everything. Exhale, compression, but it's expanding the back. You want to make it a little harder, get a little bit more opening. Bring your hands overhead, either reach overhead. What I do at home is I use a nice little hand pillow. So I'm stretching out my chest. You feel how those ribs, you see how those ribs come upwards. So now it's a little bit more of a fight to drive it downwards, and I feel more stretching of my back and my spine. Hold. 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 Realistically, all you need is 5 breaths. But what I teach my athletes, what I teach everybody, 3 sets of 5 breaths. So take a little break and then do 5 more. You really only need 5, but 15 breaths. Make sure as we get at least 5 good breaths in there. So again, squeeze the foam roll, drive the knees down, hands wherever's comfortable, do whatever you want with the hands. I like them here. Do whatever's comfortable. Inhale into the belly, a nice expansion out through the belly, out through the side, and hopefully eventually you'll learn how to expand into the low back. As you exhale, actively exhale, push the air out, driving my ribs downwards, pushing my side bodies outwards. 4 seconds in, hold. 4 seconds out, hold. Normal to feel lightheaded, normal to feel got a rush of blood to your head, normal to feel actually out of breath, normal to sweat. It's a relaxing position, but like I said, it's stressing your body in a way that it hasn't been stressed. You realized, how can I actually exercise by breathing? How is this exhausting? I breathe all the time. We're just teaching your body how to breathe, how to engage the right muscles through breath. It'll take some practice, but give it a shot. And if you're in a lot of pain, just lay in this position. Don't even worry about breathing. And then eventually add in breathing and try and get those chemicals flowing through your brain and into your body. Good luck.